Hello, this is Dr. Marshall Ross. I am the Chief Scientific Officer at the Newly Institute, and I'm here today to tell you guys about breathing. Breathing is a technique we can use to tame our physiology, to harness our fight and flight response, and soothe our nervous systems. Let's dive in. Anyone who has experienced a panic attack or anxiety understands that the mind can cause powerful physical symptoms. Chest pain, shortness of breath, even loss of consciousness. Our mind causes real physical symptoms on our body. I'm an emergency physician, and I see patients regularly who present with pain that their brains cannot differentiate from a heart attack or blood clot or an asthma attack. Our minds, particularly in moments of stress, can cause real physical symptoms. What is less commonly appreciated is that movements of our body can have powerful effects on the mind. So the same way your mind causes chest pain, you can change things in your body to make your mind feel better. Here's an example. We all know when we feel happy, our face starts to smile. We're feeling elation, we're feeling joy. That presents on our face. Certain muscles in our face move in particular ways that generally cause a smile. What is less well known is that if we actually force those same muscles in our face to move in such a way that they form a smile, our brain starts to feel happier. It goes both ways. We feel happy, our face smiles. But if we don't feel happy and we make ourselves smile, our brain starts to feel happier whether it wants to or not. Pretty cool. So here's what I'm getting at. Here is the concept. The neurologic communication pathways between our mind and our bodies work in both directions. Here's another example. When you feel anxiety, panic, or stress, your fight or flight response kicks in. Your brain releases adrenaline or epinephrine, and that has effects on your body. You have an increased heart rate, increased blood pressure, increased respiratory rate. And this sometimes is appropriate. If you're walking through the woods and a bear jumps out, this is what you want. But often, this trigger is inappropriate. Maybe it is seeing something that reminds you of a past trauma. Maybe it is some other memory that is inappropriately triggering this fight and flight response. Now, most people can't consciously control their heart rate, and most of us cannot control our blood pressure, but we can control our respiratory rate. And this, like other neurologic pathways, goes both ways. We can control our breathing to impact the state of our mind. By changing our breathing, we can change our levels of anxiety, panic, and stress. By breathing in the right way, we can activate our rest and digest response. That is the opposite of your fight and flight response. The other term for it is your parasympathetic nervous system. And by doing so, we can soothe our nervous system. We can calm our brain and our bodies down just by controlling our respiratory rate and our breathing. So how this works, this particular communication pathway is all about the vagus nerve. So the vagus nerve goes directly from your brain to multiple areas, such as your diaphragm, your heart, your gut. And it connects these directly to the panic center in your brain. So if you're panicking, your brain will send signals to your diaphragm to breathe faster, breathe deeper, breathe harder, so that you're ready to run away from that bear. But if you are, having a panic attack, experiencing anxiety, you're in a very elevated state, what you can do is you can control your diaphragm to send soothing messages back to your brain to help calm that fight or flight response, help get yourself back under control, help you tame your physiology. So what I want you to do now is take a minute and feel your pulse. It's next to your thumb, right around here. You should be able to feel your heart rate. So just take a minute, try to feel your heart rate. Try to get a sense for the cadence, the rhythm, the general speed of your heart. Now I want you to start breathing fast, and I'm going to do it with you. Breathe quickly while you feel your heart rate. What you'll notice is that as you intentionally increase your respiratory rate, your heart rate's going to go up. Now, I want you to do the opposite. I want you to take a deep breath in and hold it while you feel your heart rate. Now slowly breathe out. Do you feel that? Do you feel your heart rate come down as you exhale? We know that prolonging your exhale activates your parasympathetic nervous system, calms your fight and flight response, increases your rest and digest response, and helps soothe your nervous system. We'll give you some techniques to work on that later. The interesting thing is if you put a sat probe on and monitor someone's heart rate or cardiac monitors, you can see the same thing. Intentional adjustments in how they breathe will affect your heart rate. And that is all just mirroring your nervous system, your fight and flight response, and your rest and digest response. Think of it this way. Breathing is a lifeline to help pull you through your most challenging and stressful moments. Let's dive in and learn a few breathing techniques. Just so that you're aware, these techniques are available with an audio guide through the Homecoming app. But for the sake of this presentation, I'm going to talk you through two of the most common and most useful breathing techniques. So the first is tactical breathing, also known as box breathing. This is a common technique. This is used by Navy SEALs, it's used by fighter pilots, it's used by EMTs, it's used by emergency physicians. I teach this to emergency medicine residents to help them calm themselves down during an intense resuscitation. It's a very commonly used and effective technique, and it's simple. It's shaped like a box. So we'll just follow it on the left. The whole idea is that you use counts of 4 and work your way around the breathing cycle. So let's try it. We'll start when we hit breathe out at the bottom. So take a breath in, breathe out, 2, 3, 4, hold, 3, 2, 1, breathe in. So hopefully you guys have an idea of how that works. The key to this, like anything, is that you can't just look at it once and expect it to work. As you're starting to get increased anxiety or start to feel panic, this is very effective, but you have to be used to it. You have to have practiced it. So it's good to take a few minutes, practice this technique. Then when you start to feel yourself entering a cycle of panic or anxiety, you can use this as a tool. You can use this to calm yourself down. But again, you got to practice it. And use it early. Don't wait until your body and your physiology is totally out of your control. Try to use it early to bring yourself back down. So that's box breathing. And again, you can access more guidance through the Homecoming app. The second technique I want to tell you about is called the 4-7-8 technique, or 4-7-8 breathing. The whole idea here is that we extend the exhale, which further activates our parasympathetic nervous system. This is like described as a natural tranquilizer for the nervous system. So the technique here is you inhale for 4 seconds, hold for 7 seconds, exhale for 8 seconds, and then repeat. So we'll just try it once here. Inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, exhale, 2, 3, 4, 5, 6, 7, 8. Try it a few times on your own. I'll give you a minute to do so. Good. Notice how you feel. Is your heart rate slower? Do you feel a little bit calmer? I do. Finally, practice, practice, practice. The more you practice, the better you'll get at this. That's all we have for today. Again, to access more resources, check out our website, Homecoming app, and good luck. All right, thanks. Bye.